So once we have made the diagnosis of osteoarthritis, how do we treat this condition? For those who have pain that is persistent, that does not respond to non-medical treatment, we would introduce medications, and the medications we use are, in medical terms, referred to as non-steroidal anti-inflammatories. They're the commonest used, or painkillers, as people would often call them. And the pain is managed in a graduated manner, in a step-by-step manner. In extreme cases, we combine up to 3 medications to be able to manage the pain. There are other non-medicinal modalities that we use, things like a walking aid, such as a walking cane, to support weight bearing so that there is less weight carried on the limb. So one would be advised to use a walking cane or a crutch if they are comfortable using a crutch or a pair of crutches. Sometimes we have the joint lubricant which can be injected into the joint. This will improve joint mobility and reduce pain. Over and above that, steroids are also used, and steroids reduce the inflammation in the joint area and are able to deliver pain relief for variable periods of time. When all these do not relieve pain, or when the condition progresses to an extent that either the joint range of motion is being affected, the joint is becoming stiff, whereas the joint is moving all the way, bending all the way, now the range of motion is getting reduced. Number 2, the pain is so bad that it requires daily use of painkillers. For 3, the arthritis is such that there is observable joint deformity. We recommend surgery as a mode of treatment for this condition. The surgeries that we do may include breaking the bone and realigning the joint, what we call osteotomy. The second procedure that we do is called joint replacement surgery. Now, in joint replacement surgery, what we do is because the problem is the smoothness of the joint. You have a joint that is rough, that is causing pain, that is limiting movement. So what we do for you, we will shave off the worn out surface of the joint completely and take away all the cartilage that is worn out, okay, on both the upper side and the lower side, okay. So the hip joint can also be worn out, where cartilage on these aspects of the joint is worn out, and cartilage on this surface of the joint is worn out. Or in certain situations where this bone is broken at what we call the neck. This is called the neck. So if it's broken at the neck, sometimes we make a decision to replace that part of the bone, okay, with a method, what's called a prosthesis. So what do we do if we are treating the hip? What we do is we will operate through the many approaches we can use to access the hip joint. Once we have opened the hip joint, we will dislocate the joint using that small incision, okay, and implant. So the implant will be inserted on this surface and fixed on the femur side. We also have a device which looks like this. This is called the femoral component, okay. It has a round head which is sized to be compatible with the implant on this side. So once we do that, we will fix this in place. We will tunnel this bone. Once we tunnel it, then we will fix this in place, and so it sits like that. So when you put the two of them together, then you have a joint that now from inside looks like this, okay? But from outside, one should not be able to tell that you've had a hip replacement done, because a well-done hip replacement should reproduce the same movement that you had prior to the surgery. Now for the knee, we will do a similar procedure, okay? Only differs in the design of the implants. So from a joint that initially looked like this, but which has worn out cartilage on this side and worn out cartilage on this side, we will trim off the worn out cartilage, so that if this was the initial shape, this is what we will emerge with as the eventual shape of the trimmed bone. The bone will be trimmed so that the cartilage the worn out cartilage is taken off, and then a tunnel is made in the bone. Once you've done that, so for the tibia, we have an implant that looks like this, what's called a tibial tray. We will fix it in place, and it is here fixed with cement to hold it in place. Once that is done, okay, we have a separate piece called the liner, which we will then fix in place. It's a plastic surface that we will lay on top of the metal. Okay. Now on the femoral side, once we trim very well, okay, we will then fix a metal implant that is the same shape and size of the bone which has been cut off, so that the bone then and this is fixed with bone cement. So immediately after it's fixed, it's almost impossible to remove it without damaging bone. It binds very strongly to the bone. So once the two are in place, when we put the joints together, we end up with a joint that now moves smoothly and without friction. Okay, so that is called a knee replacement surgery that we do for correcting this, to correct this condition in the knee. We have comparable surgical techniques for arthritis in virtually in most of the other joints of the body. The shoulder can be replaced with an artificial shoulder. The elbow can be replaced with an artificial joint. The ankle joint can be replaced with an artificial joint. Even the small bones of the fingers can be replaced, but some of those may not be available locally, or may be available but in limited facilities in this country. So in a nutshell, that is how we treat this condition. Once the replacement is done, we expect that the patient should be able to move without pain, or with much less pain that they were experiencing previous to this surgery. Thank you.